Chronic cough, when cough persistent for more than 8 weeks in adults and more than 4 weeks in children. So more than 2 months in adults and more than 1 month in children, it is considered as chronic cough. There are many causes which is very well known, like postnasal drip. Patients have recurrent allergic rhinitis and they complain of having cough whenever they go to sleep. This is known as the one of the reason for this is PND, and other is asthma, chronic bronchitis, gastroesophageal reflux disease, those who have retroexternal burning and symptoms of acidity and all those things, they they have chronic cough, and then infections like tuberculosis, irritants, those who have working atmosphere which have various dust or occupational paints and colors and they are allergic to it, they lead to disease like chronic cough. Then some mediastinal diseases, when patients is having mediastinal lymph node enlarged, such patients have chronic cough as a symptom, prominent symptom. Basically, whenever cough is there, if it is acute, then it will be subside in 4 to 5 days. But if patient has symptom which are troubling with his day-to-day life or day-to-day activity, then definitely he should consult with a doctor. And as government is promoting, whenever you have cough for more than 15 days, you should consult a physician to look for tuberculosis, because in India it is very common cause of chronic cough. So whenever you have cough for more than a week or more than a 15 days, you should consult your doctor. Whenever a chronic cough patient comes to us, the most and foremost important is the history. We ask them from when and at what time he is having cough. Many times patient have cough during night only. So PND is the most common cause. So history is most important. Then other tests we ask in such patients are chest X-ray to look out for any chronic infection or bronchitis or any other symptoms, any other disease like malignancy or cancer. Then we ask for spirometry in such patients to rule out asthma and chronic bronchitis in such patients. And other tests are CT scan, bronchoscopy. These are the common tests. And many times, cardiac patients has also have symptoms like chronic cough for persistent. So ECG and echo is one of the other diagnoses which can be utilized in such patients. The other symptoms are associated with the cause of the disease. Like if patient is having infection, then he may have fever, or he may have expectoration, production of mucus, or he may have weight loss or loss of appetite and all those things. If patient is having malignancy or he is having pleural effusion, then he may face chest pain. It could be either left or right or bilateral. So depending on the etiology of the chronic cough, other symptoms may or may not persist. As cough is of more than 2 months, so we have to look for the cause. We go for the investigation, then treatment of the cause. If it is infection, we have to work out the infection. What is the bacteria or virus or fungus behind it? We have to look for the cause. And if it is malignancy, we have to go for to treatment of the malignancy. So first we have to evaluate what is the reason behind the cough. Then after knowing the reason, we have to treat it. In the meantime, when patient is having asthma, we have to treat asthma. Basic factors which includes in each and every one is lifestyle modification. You have to go for avoidance of allergens, avoidance of pollution, avoidance of irritants, or avoidance of smoking. And you have to control your allergies, you have to control your asthma. All these things may help in controlling your chronic cough. Majority of lung diseases in acute cases or cough cases or like bronchitis cases, it depends on lifestyle, like avoidance of exposures of this irritants, allergens, lifestyle modification like regularly exercise, pranayam in your routine life, good hygiene, maintaining good hygiene, good food which contains antioxidants. And if you have allergies, yeah, if you have asthma, then controlling it in a better way by consulting your physician regularly. So it will help you preventing this respiratory diseases like chronic cough and chronic bronchitis.